One, booster ignition, and liftoff.
Hello and welcome to the Health and Wealth podcast with your host, Archie Hall. Today, I'll be talking about a special interview I got to have with Professor Ben Wheeler at the University of Exeter's Medical School. In this episode, I got to talk with Ben about climate change and the impacts on your health and epidemiology. Dr. Ben Wheeler is a quantitative health geographer and environmental epidemiologist. His main research focuses on adverse and beneficial impacts on the environment on public health and well-being, also with mental health and the population scale, applications of GIS and spatial analysis, and environmental and socio-spatial health inequalities. The first question I asked Ben was if epidemiology in health had much recognition within the climate change world, as you've talked about it before and how health and epidemiology is worsened by climate change. He had this to say.
It's starting to, I would say. It's definitely been, I think health has been very late to the party with climate change. I think, think about how many IPCC meetings there've been, all the different COPs and so on, and public health has tended to be fairly not well represented there. I think it's only fairly recently really that public health and medicine has really gone, actually this is something we really need to care about, and therefore health starting to have more of a presence, but it's definitely pretty late in the game, I would say.
Climate change often influences human health. Some of the effects that are brought on by climate change include cardiovascular disease, injuries, and premature deaths. This can also be because of water scarcity in a lot of dry countries, the geographical distribution of food, and waterborne illnesses and other infectious diseases, and also threats to mental health. IPCC report that was published earlier in the year, as Ben Wheeler brought up, showed that even in southern Europe there was water scarcity. I asked Ben what type of data he collects.
All sorts, really. I mean, for me, working in sort of epidemiology and especially environmental epidemiology, I tend to mostly use data that other people have collected, so secondary data. So I work a lot with kind of health survey data, so lots of national governments will run health surveys and we can use their data.
Scientists and professors like Dr. Ben Wheeler use data sets and quantitative data to help find epidemiology and health impacts of climate change. Climate change is predicted to have a significant impact on communities throughout the world in the future decades, changing the patterns of various environmental exposures and catastrophes such as excessive temperatures, heat waves, wildfires, droughts, and floods. As a result of these exposures, human illness and health outcomes can be affected. Climate epidemiology is crucial for educating policy on climate change and the hazards it possesses to the public health. To understand the existing and possible future implications of climate-related exposures on human health, climate epidemiology draws on deep integrated cooperation between epidemiologists and climate scientists. With cardiovascular diseases being looked at maybe being one of the largest public health impacts, mental health and stress is one of the major causes of suffering. This is due to maybe extreme weather events that can affect mental health in several ways, or flooding or droughts. So following disasters, mental health problems increase among people with no history of mental illness and those at risk. With data from floods about mental health, we can see that PTSD, depression and anxiety, 20% have been diagnosed with depression, 28.3% with anxiety, and 36% with PTSD, showing how climate change can affect mental health with a large number of people, as floods are very common throughout the world. To prevent potentially catastrophic climate change consequences, the total anthropogenic carbon dioxide emissions must be limited to 209,000 billion tonnes by the end of the century, which would be very hard to do. with the current governments and UN goals. Total emissions since 1870 were just half of this in 2011. Our health is saved and preserved in the future. We need to invest in climate change and public health research, monitoring and surveillance to guarantee a better knowledge of local and national adaptation needs and possible health co-benefits of climate mitigation. We need increased funding for climate-resilient health systems throughout the world, ensure that coal is rapidly phased out of the global energy mix to protect our cardiovascular and respiratory health. We need to encourage a shift to cities that support and encourage healthy lifestyles for both people and the environment. For example, Oslo, with the introduction of EV cars and no diesel cars being allowed to driven inside the ring road in the city. The construction of a highly energy efficient building stock, the convenience of low-cost active transportation, and expanded access to green areas are all steps that need to be taken to achieve this. And that wraps it up, folks. This has been a fun episode to record, and it was fun to interview Ben Wheeler for this week's episode of the Health and Wealth Podcast with me, Archie Hall. Thanks to Ben for helping us and all the listeners understand the benefits of why climate change is important for our health and how the health and epistemological need to be looked at more with climate change, and how we can be affected by climate change in the future if we don't sort it out. So thank you for listening and hope you enjoyed it.